Hello friends, and welcome back to the channel. I'm glad to be with you. Today we have a very special video, a very special conversation actually, and it was so full of really great information that I actually had to split it into two parts. I get a chance to talk with and interview a friend and colleague, Dr. Catherine Larson. We were able to catch up with each other at the American Academy of Child and Adolescent Psychiatry Conference that was held last fall. And so this first part that you'll get a chance to hear, Dr. Larson shares some of her passion as well as resources for families and siblings who are caring for someone or have a sibling with a special need. I hope you find this helpful. Take good care. Right. So Dr. Larson, welcome to the YouTube channel, and glad that you could be with us and join us here today. I was hoping that you could share with us maybe some of your passion about supports and working with siblings with special needs.
Yeah, so I would love to. So siblings and kids with special needs is a real passion of mine, both professionally and personally. So my younger sister was born with a rare genetic condition, a deletion on her 18th chromosome called 18q-. And so my mom started a research center, got her PhD in genetics, and also started a support organization, the Chromosome 18 Registry. And within that organization, I started a sibling group. And then also before medical school, I worked at the research center as a research assistant and started my own study on siblings and kids with special needs. So I have professional and personal interest in that area. So it's something I'm very passionate about.
Wow, incredible, very incredible. And could you give and share with parents and kids maybe a couple of tips that they might find helpful or things that you've found through your research as well to be helpful for families and children?
Yeah. So there's, so many things. I could probably give you just a couple of brief ones that I think would be helpful. So one of the big things that we found in the research and in our study is that siblings, the typically developing siblings, are really hungry for knowledge. They want to know so much about what's going on with their brother or sister. And sometimes parents are afraid because they feel like it's going to stress the children out to tell them too much, that it might be, adding more stress to an already stressful environment. But most siblings really feel like if that information was shared, it would be helpful for them. And so one piece of advice for parents is really to share what information you have. And in our study, one interesting thing that we found is that there's quite a few siblings who don't ask any questions to their parents, even though they really want to know. And so I would advise parents, go ahead and be proactive and start that conversation. Start answering, start explaining. And it's not a one-time conversation. It's an ongoing dialogue that's going to become more detailed and more complex as they get older and they understand more, and probably as the family starts to learn more about the condition. But including the sibling, both in conversations with parents and also with doctors appointments, therapy appointments, whatever kind of appointments the kid's having, to keep them involved and to help them understand, because it's really important for the siblings. And then a second thing that we talked about a lot in the research and that's out in the research is all the range of feelings and psychological consequences. So, we found, just a wide range of emotions, lots of happiness, lots of pride, lots of anger and frustration, and similar things that we find in all typical sibling relationships. The difference is that with siblings and kids with special needs is there's a lot of guilt around any anger and around the negative emotions, but in any sibling relationship, those are normal and healthy things to have. And so that's part of our emotional growth, and if siblings are denied that because they feel so much guilt and shame about it, then that's going to kind of impede their emotional development. And so one thing that parents can do is kind of model processing those emotions, expressing those emotions, both positive and negative, with parents and with family members. And also one thing that's really helpful for siblings is getting them plugged in with other siblings and kids with special needs. It can be, it's really hard for siblings to talk about their feelings because they really feel like they might get judged and that really nobody's going to understand because their situation's so unique, and so is it even worth telling anybody? And it can be really therapeutic for siblings to meet other people and to say things that maybe they've never said out loud before and have this experience of everyone else in the room having had the same thing, you know,
Right.
and so it can be very healing and very therapeutic. So finding opportunities. SIB Shops is a national organization. They have lots of chapters that they run things like this. Hospitals sometimes have them. Doctors' clinics have them, and also just individual organizations often have sibling programs at the summer conferences, which is what our organization does, and it's been really great for our siblings. So providing that opportunity to express those emotions and process them would be a second thing. And then the third thing, siblings really love to be involved and care for and help their brothers and sisters with special needs. Caregiving can be a burden on them if they take on too much responsibility and they neglect their own needs. But a lot of siblings end up growing up and they put this becomes part of their identity. A lot of siblings go into helping professions. They go into nursing. They go into therapy. They go into medicine. Because this has become part of who they are. They're a helper and a healer, and that's a positive thing for them. And so giving them those opportunities to have those experiences, those relationships with their sibling is very positive. And then something that parents might not think about if their kids are really young is that if your special needs child is going to outlive you and is going to need care for their entire life, somebody is going to have to take over when you're gone. And so fostering a good supportive relationship between your children and making sure that it's good and strong from the time that they're young and that your typically developing sibling needs are met, then we're setting the groundwork for a good positive interaction when they're older. So typically developing siblings also really take a lot of pride in their brother and sister's abilities and sharing those abilities with other people, and also teaching people that their brother or sister is human just like everyone else, and that they have the same needs as everybody else, and they can really become an advocate for them, help other people to understand how to interact with them, and so that helps their sibling because it helps them integrate into social situations. It helps other people who might not know how to interact with people with special needs, so that helps them interact with their brother or sister and just people in general who have different needs. And so really they're kind of helping the wider special needs community. And so this is kind of one way that when we really support siblings, they can have a really positive impact.
That's incredible. Well, thank you so much for sharing your great insights, and so what I'll do is to folks who tune into the YouTube channel, we'll include links to some of the resources and things that you've mentioned, as well as your website. So again, thank you for taking out the time to be with us today.
Thank you for having me. I appreciate it.
So I hope you find this helpful. Take good care.